Hi, my name is Chris Hayes, and I'm the founder of HPT Optimal Health and Fitness right here in Paoli, Pennsylvania, which is actually a division of Hayes Physical Therapy. And I opened this division a few months back with the intention of really being able to take a physical therapy patient that may be discharged from physical therapy through a continuum of transformative wellness as a total body approach to staying healthy, to preventing injuries, to living your best life, really, and to being able to promote longevity in life, but healthy longevity, right? Where we feel good enough to do everything that we want to do. We feel strong enough to do everything that we want to do. So it is a medical fitness division, and it is something that's designed for total body transformation. So it is something that we're really proud of, and we have many clients who are really embracing this and looking forward to these one-on-one workouts, which are designed by me as part of this HPT Optimal Health and Fitness. So how is it different from other programs that might be out there? Well, first of all, my background, as many of you may know, I've been a physical therapist for 38 years, and I specialize in orthopedics, sports medicine, and functional movement, and have many certifications in a lot of those areas. And so this program is to take a deeper dive into a whole body transformation. And it also is extremely beneficial if you're concerned about having pre-existing injuries, or you've been told that you're having, issues with bone density or sarcopenia, which is a loss of muscle mass as we age, and it happens. And it's really important to know how to work with that in the most effective way, and not to compound that with more injury. So it's really true that 50% of people will get injured when they start a gym program. And why might that be? Well, first of all, it's really essential to understand and have metrics on how well are you moving. So that's one of the first things that you'll learn when you come in as a client of HPT Optimal Health and Fitness. I will be doing a medical assessment and a medical screening on you. And that's really, really important to understand everything that has been going on with you regarding any particular injuries or surgeries, and how to best support that with a fitness program, a medical fitness program. I also serve as a PT concierge person in this role as well, meaning that we may be doing fitness workouts with you, and then one day you might come in and say, you know what, I tweaked my back, playing golf over the weekend. And, that's something that I'm going to address right away with my background and my unique skill set. We're going to jump to that first, clear that issue, kind of land a diagnosis on what's happening with the back, give you a series of different exercises. Probably we're going to use the Newbie by NewFit, which we're going to be using in our fitness program as well, but we're probably going to use that to get you over that acute hump. And we're also going to use class 4 laser when that's appropriate too, to get you back as quickly as possible. And then we'll kind of segue that right into the work that we're doing on a medical fitness model anyway. So day 1, coming in, we're going to do that medical fitness assessment. And that will also include something called a heart rate variability study, which is basically a 5-minute assessment that is an EKG of the heart that gives us a lot of tremendous information about how you adapt to stress, how resilient your nervous system is, how stressed out your nervous system might be, what's your immune system like, and it gives us some really great information, including your biological age. And biological age is, how healthy really are you? You could be a 60-year-old by your birth date, but you could be a 75-year-old by your biological age, which isn't a good thing. So our goal is to get you to a 45-year-old if you're a 60-year-old, or the lower we can get you, where everything, all of your systems are working really well. And that's a really accurate way to know that information through a heart rate variability study. And honestly, only the high-end universities that study sports science, as well as the professional athletes, really track this information. But it's super, super valuable, because if I see that you're not very resilient and you don't really do so well with this heart rate variability test, we also have ways to facilitate improving that by working with your vagus nerve and by working with breath work and some different things, but to be able to teach you how to be able to quickly adapt and go from your fight and flight nervous system to your rest, digest, and heal. And by the way, the best athletes in the world do this in an instant. And the worst ones can't do it. So it is actually something that needs to shift all the time in our day-to-day interactions, even in our sleep and our dream patterns. That heart rate variability changes. So we have a way to measure it, and then periodically we measure it, every 4 to 6 weeks throughout your HPT program with me. Unless one day you happen to come in and say you're really dragging, then I'm going to measure it right away to see, honestly, what's the state of your health and what's the state of your nervous system. So I know what kind of exercise is safe for you to do so you don't hurt yourself. So really great information with that advanced healing technology called heart rate variability. Secondly, I'm going to do a head-to-toe movement assessment on you to see, even if you're not having pain in certain areas, if you're not moving well, it's going to become highlighted really quickly. And we're going to focus on your weakest links and start to get you to move well before you move often and under load. So often, people go right to a gym setting. They have these, grand goals of getting stronger, fitter, losing weight, and their movement patterns are so poor. And they don't know it. It's never been measured. And so it's very quickly for them to get injured, because they're doing it then maybe 3 to 5 times a week, putting those forces through joints that aren't moving well, and they're doing it under load. So it's a perfect disaster waiting to happen. So it is important to understand whole body movement and how you're moving and where you're dysfunctionally moving and where we can help to then target our exercise programs to get you moving better. In addition to that, then we use our advanced healing modalities such as the Newbie by NewFit. And again, we are one of 7 practices in Pennsylvania. That's a medical practice that uses the Newbie by NewFit for injuries as well as for fitness, as well as to downregulate your nervous system with your vagus nerve, there's a lot of applications with this. But for example, the professional athletes use this to actually recover from a game that they may have played. Saquon Barkley gets banged up on the football field. There's a way in which, he's able to use the Newbie and actually recover those muscles really, really quickly, or clear those muscles really quickly. There's a lot of professional sports athletes that use this. And they also know that if they don't do that, then they can't get strong, because the brain is going to be perceiving a danger message or a threat, and so it's not going to allow full strength to occur. So from a rehab standpoint, we use that. But then in fitness, we actually target muscle groups, and we use the electrical current to help you get stronger without putting excessive forces through your joints. So it's like a 10x multiplier, for example. So let's say if we were working on your legs and we were trying to improve your squatting ability, or your ability to get up and down from the floor, or your ability to respond quicker on the pickleball court, excuse me, we would be using the Newbie to actually target those muscles, and its effect is like doing 10 times that amount of workload at the gym without putting those forces through those joints. So that's a really great advantage for people that already have pre-existing conditions, or they have bone density issues and they're afraid and they're not sure how much load to put through those joints. You'll be loading those joints with your body weight and with much less weight, but having the same impact, being able to get your muscles stronger. So what happens when those muscles actually get stimulated and they're isolated with the newbie is that those muscles will break down just like they would if you were doing a hard workout at the gym. And then they rebuild and they get a little bit bigger, and you'll have the same muscle soreness that you would have if you were doing a hardcore gym workout that maybe would take you several hours to do. And we're able to do this in under an hour, more effectively, isolating those areas without putting those heavy forces through the joints. So we have a fun program for you with HPT Optimal Health and Fitness, where I design those programs. It's a whole body fitness workout. And then it also includes times when you might, have come across and you've injured yourself and we have to address that quickly. Or you may be out of the region. You might be in Florida, you might be in Colorado, and you get hurt. That's something that we can easily do via telehealth, is be able to quickly identify, what the injury is, how to best treat it, so that you can feel better, even if you're not in, Pennsylvania. So there's a lot of great reasons why I started HPT Optimal Health and Fitness. It is a service that's not for everyone. It's an elite program for those who really want to take a deeper dive into transformational health. It's typically something that's a year-round program. Some folks see me once a week, some folks see me twice a week, and it's a lot of fun. And we address things from, the weekend warrior to the semi-professional athlete, or the high schoolers and collegiate level athletes that want to get strong, pre-season, during season, after season, and also really for anyone looking to live a happier, stronger, fitter lifestyle. If you're looking for a quick fix, we're not the right program for you. If you have an injury, you have two options. Either you could, go through our traditional physical therapy via insurance, or you could see me all inclusive and use me as a PT concierge, where everything we do is going to be including our high-end advanced healing modalities. So you have a couple different options. So check out our information on the website. Certainly available if you have any questions at 610-695-9913. And we have pay-as-you-go options as well as an elite VIP membership. And the elite VIP membership is really special because it also has a really sweet piece to that, where 10% of that membership goes back into our physical therapy practice for those patients that really just can't afford advanced healing modalities and are in desperate need. So it's an opportunity for you guys to also help out some of our people that are in need as well. So I hope that I've kind of explained the difference between coming to see me for HPT Optimal Health and Fitness, and how that's very different from maybe going to the gym. It doesn't replace you going to the gym and having, the social interaction with other people, but the value of seeing me once or twice a week is to really fine tune and getting you moving well and getting you stronger, and before you move often and under load, and then to be able to address anything that comes up anywhere in between. So we have a lot of fun in our sessions, and I really hope to see you soon, and be well.